gone by since we've first started, but we're really excited to share with you our accomplishments in the last year and also your accomplishments that we've been hearing about across the province. Again, just be a reminder that you're placed on mute and that if you do want to put in a chat, I'll show you a couple of buttons here that you can click on in a second. We will be recording this session, so if you have some colleagues that wanted to hear it and were unable to attend today, we will have all the information on how to access it through our Collaborate site. This is our first anniversary celebration, and for those of you who celebrate anniversaries, you'll know that this is a paper anniversary, and we're pretty excited that we will have some gifts to impart to you at the end of the call. Just to quickly touch on some technology things here, this is where you'll find the chat button. It's that near the bottom of your screen, and you'll just, if you want to respond to all participants, make sure that from the drop-down box you see that it's to all participants. Enter your text. And as I mentioned before, if you're having some technical difficulties, you can just choose or change the participant drop-down to host and send your question to the host, and they will work on the back end to get you sorted out. If you are seeing the screen but not hearing my voice, you might have you might need to turn the volume up on your computer, or sometimes it's easier just to call in, and there's a 1-800 number that you can call in on the screen. All right, for this webinar, you're also going to need a phone or a laptop because we're going to try an experiment. So please have them handy for one of the activities that we'll be doing later. Yes. Okay. So just before we get started, in the chat box, could you please type in your name and the organization you represent in the chat box to all participants? This will be a good practice for you. And if you are in a room with several people, if you wouldn't mind just letting us know how many people are in the room with you. I'm going to give you guys a few minutes to put in your names, where you're from, and how many are with you. And I see some of you have already started, so it's great to see. Got lots of people. Got Helena Country PCN, Saddle Hills PCN, welcome. Cold Lake PCN, Prairies University, great. Good to see you and welcome everyone. Got Tammy from Mosaic, excellent. Keep typing. We're really happy that you joined us, and we're going to get moving on while you type in your names. Where are you calling from? So your hosts today are people from your from the Improvement Facilitator leadership team. We have Anjil. Anjil is from Heinzman from the Edmonton Southside Primary Care Network. We've got Alana Dryland from the Bighorn PCN in Hinton. Myself, I'm Liz DeMar from Chinook PCN in Lethbridge, and Lori Choma from AMA Top in Edmonton. We also have a couple of guests today that we will be asking to speak later on. So we're really excited to be here and sharing our day with you, our session with you. So the next slide is where I'm going to ask you to pull out your phones and have them ready, because we're going to try an experiment. We are hoping that this will work out. It's something new, and it's like doing a little PDSA. It's almost something that you may want to use in one of your meetings or gatherings that you have with your teams. It might be something fun to try. So backwards, hold on, folks. Here we go. So you're going to need your phone, and if you can go, or your laptop, you can go to menti.com and type in the code 666-7727, and one of my colleagues is chatting that information or typing that information into the participant chat screen as well. So it's METNTI.com, code 667727. And what we wanted to ask you was, how do you celebrate anniversaries? And I just want a reminder that we are PG, so if you can put in some appropriate ideas. And we're going to create a Wordle. So we're going to pass the screen over to Anjil. I just want to make sure you have the website, MENTI.com, and the code was, lost my code, should be in the side there, 667727.
And Anjil, can you tell us how you're signed in?
What do you mean? Oh, I signed in as a speaker.
Are you with the Edmonton group?
I am. Can you hear me?
Yeah, we can hear you. We just need to be able to pass you the control.
Oh, yeah, sorry. I am the Edmonton IF group, yeah.
Okay.
That's great.
Leanne,
that's okay, because in the background, you guys, these words will be up on the screen in a minute, and we'll show you what we're trying to do here. Oh, fantastic. Great.
Are these all the words that people are putting in?
Yeah, so this is real time. People are putting the words in, and it's just making a Wordle dynamically as you guys send words.
Yes. Words?
Well, looks like a lot of dinner and cake. And Anjil, I'll pass it over to you.
Okay, I just put one.
Bottom right corner, 54 people.
Wow, that's cool. 54 people have contributed.
Wow, that's good.
So you have other words? Good for it. Is that word?
I know, not
Spark words? Okay.
And
Anjil, I'll pass it to you now.
yeah, I think Leanne, can you pass me the control, and I'll control the slides?
Ooh, kisses. I got in there, so let's see where it ended up.
I think I'll put it at the end.
I got in there, let's see where it ended up.
All right, are we back with our aim?
Yep.
Yes.
We are. Sorry, that was confusing. The PDSA worked, I think, but I think sometimes like switching between the WebEx and the website's a little tricky because when you go into the full screen mode. But I think it was cool. And what I'll do is at the end of the day, I'll make a screenshot of that and send it out, and then everyone can have a look at the words that we all put in. And just so you know, the bigger the word, that means the more people will kind of put that word in there that voted for it, I guess you would say. So I'm just going into the next slide, which is around the aim of the IF network. I'm just going to put this on full screen as well. There we go. And we've got a new, what we call a cell sheet, which is a description of what the IF network is. And that's on the Collaborate website, and we will give you details at the end of the webinar just so you know where to find it. And we also are planning to share this sheet at the IF orientation sessions, just to kind of explain like what's in it for you and what's the point of having an IF network across the province. So just briefly, I mean, I'm not going to read to you what's on the screen, but you can have a look at that while I'm talking. Basically, the IF network offers a monthly interactive 1-hour webinar, like what we're on today, on topics that are selected by the members of the network. So there's a lot of opportunities throughout the year to give feedback to the webinar team. The Collaborate website is a resource which has library of resources and a discussion board as well. It would be fun if people started using the discussion board a little more because we've had a few questions on there, or a few comments and things, and it'd be nice to have a bit more discussion, which would be cool. So have a look at that. We also send out occasional email updates with content that's relevant to IF. We try and do that 3 or 5 times a year, 3 to 5 times a year. And we also are involved with putting on an annual change agent day that we co-plan with our provincial partners. So if you, so we're celebrating our anniversary here, but if you want to look at this timeline slide that we put together, the highlights would be that in 2014, the sort of concept of a provincial IF community of practice was discussed. And in March 2017, we started to recruit people from each zone to co-design this community of practice. In May 2017, we all came face-to-face to talk about the co-design team. And then in October 2017, so exactly a year ago, we presented our first IF webinar. And maybe some of you were there. I wasn't, but it sounded like it was a good time. And since then, we've delivered 10 webinars. So another big event recently was in February, where we got feedback from members. And thank you very much for participating in the survey, because your feedback helps us to grow and develop more webinars and tools to help everyone in the network. We also got together in June for another face-to-face group meeting, and that's where I got to meet everybody on the team. That was in Red Deer back in June. So we do try to meet about once a year, I think is the plan, just to keep in touch with everybody and when there's new members and stuff, so they know who everybody is that they're talking to on the phone every couple of weeks. So next, we put a call out for your stories about successes as an IF in the past year, and we've got a couple to share today. So first off, we have Ariel from Kalana Country, who's going to talk about some successes at the PCN there.
Hi there. I was super excited to be able to respond back to the email with looking at how we were knowing we were successful, how we were getting there, and how we helped people work to make positive changes. So some of the stuff I highlighted, how did you know you had been successful? A lot of the time what I was getting was direct feedback either from staff, patients, or physicians. This was also sometimes how I knew I had been unsuccessful. Hearing that patients were happy with care, staff and providers were having improved understanding, workflow, and satisfaction with their roles were all ways that I could hear that we were making worthwhile positive adjustments. I also found it to be a really great indicator for success when staff and physicians were coming to me looking to make additional or new changes, and they were asking me for some help to bring these ideas to life. This feedback showed me that growth in staff and an overall positive change in the clinic was coming through. We were seeing buy-in and participation from other team members and people thinking of ideas and ways to improve and build on what we were already doing, and in some cases they were even bringing forward really new, inventive, and exciting ideas. Starting out as an IF was difficult. I know probably every IF says that they've had a difficult time making change because people don't like change. But breaking through and having some successes, all you have to do, or all that I was doing, was trying again. Sometimes ideas were proposed and changes were not accepted, or the timing was not ideal. So maybe a second or third attempt was done with time. And maybe another angle was brought forward, and the group was able to consider what I was bringing forward and get on board with that idea. I also just use whatever ear will listen. So if there's a specific staff member or provider that was listening or considering ideas or had ideas of their own, I used that and worked with them. If it wasn't necessarily what I thought we needed at the time or what I was interested in, I still used that, because if I could work with their interests and meet them where they were at, they were working with me. Once we had made progress with changes and things like that, and I had some good positive outcomes, it was a lot easier and simpler to share with others. Lots of times we were seeing more of the late adopters coming in at this point, because they were more willing to participate in more of a tried and true process that they know was already working well and was having good outcomes. The last question, how have you helped the people you're working with to make positive change? In order to help people, I'm often the person that they need me to be. So I'm either a listener, an inventor, a doer, a cheerleader, and the list can go on. Each situation and person is different, I have found, in working with this clinic and others, but often taking the back seat and allowing people to do their own thing and just helping in the background to facilitate changes and help with working out ideas is a really good place to be. It's fostered really great relationships and allowed people to take pride in their own work and ideas. I have worked in other areas of healthcare in our small community, and I can often get people into contact with others that can help. So I'm often working as a connector just to get people in the community contact information or other information that they may need to work on a change. Those are the examples that I came up with in regards to successes.
Thanks, Ariel. Now we're going to turn it over to Lori to talk about how IFs have made a difference in Alberta.
Thanks so much, Jean-Gilles, and Ariel. Thanks so much for sharing that story. When the curriculum team for the IF Network got together and said we were going to have a celebration for our 1-year anniversary and what are the things we could talk about, I stuck up my hand and I said, pick me. I want to talk about how our improvement facilitators have made a difference. And we're going to talk about a couple of things today, but I wanted to let you know that your work is being celebrated in a lot of places. The work that Alberta has done is being presented in a lot of national forums, specifically around our work with panel and screening. And the improvement facilitators working at the clinic level are being credited with bringing this work forward. So wanted to just show our group a couple of pieces. And so the first piece you see here is pretty hot off the press. It was just released on Friday. Over the weekend, your medical leadership in your primary care networks and your executive directors got together at the Strategic Leadership Forum. And through the summer, they've been at the AMA, we've been collecting the information on panel progress as we have every year. And so we were able to report back the work that we've done. So in 2018, we're now at 71% of physicians and PCNs either having established panel processes or are working toward it. And we know that there's been a lot of contributors to the change and to the progress that we've made with panel. We know we've had multiple partners. There's been a lot of physician leadership. But really at the end of it, there was something that specifically catalyzed the change to happen at the clinic level, which is what we see here on the graph. And that's our work. That is the work of improvement facilitators that has got us to this point. And like I said, it's being celebrated nationally. No other province is anywhere near taking something like this to scale and getting the engagement from physicians to do this work. So you can give yourselves a collective pat on the back for that. The second piece I wanted to show you, of course, panel is more of a clinic process, but so many of you have been facilitating change with Alberta Screening and Prevention. And this is something else that is making Alberta the envy of the country and the work that we've been able to achieve here. And there was a formal push, you'll see there in 2014. It was a formal initiative, and we were out, and leaders were out banging the drum, saying we've got this initiative to bring forward to you. But you'll see that momentum, how much it continued past the time of it finishing. And again, something has catalyzed the change that has happened at the clinic level, And again, it's improvement facilitation. It's having the improvement facilitators engaging and actually moving the work forward. And one of the things I haven't showed you, but you can always contact us and we can share it with you and available on the website, is the actual change that we've seen. We've seen a statistically significant change in screening behaviors in the province, and that's equating to lives saved. So we have to really give ourselves a pat on the back for the work and stop and celebrate what we've done for system transformation and for patients in our system. So I'm going to pause my story there because we have another success story to hear from one of our improvement facilitator members. So Sarah Peterczak from the Red Deer PCN is going to share her story with us. Go ahead, Sarah.
Okay. Hi. Sorry. So I'm just highlighting one of our success stories from Red Deer. I'm one of 3 IFs working in a large clinic that initially had 2 doctors that would work with them for panel cleanup and with ASAP. And over a period of 18 months, this clinic has had more than 12 doctors sign up. They've also gone from a clinic that offered family practice and general walk-in to a focus on medical home. So they no longer offer general walk-in, but instead it's what's called urgent access to their paneled patients. And TTNA has improved over the last 2 months, as well as panel patients have noticed the ease of access to their family doctor. And a couple other things, we've worked with clinic staff on standardization for filing results and with doctors' use of consistent ICD codes. And the doctors working with us have found that time they spend with patients is more efficient and effective as they can find results easier. They know if there's outstanding screens due and have goals set up and know how to use them. That's it.
Great. Thank you so much, Sarah, for answering the call and sharing your story with us. So I'm going to pick up and talk a little bit about the acceleration of our work and the thinking on what's coming next for us as improvement facilitators. And so when we talk about how are we actually going to move this work forward and looking at all of the work that's coming to us with primary care, when we look at those medical home implementation elements, we know that we have to move well past panel, well past screening, and much deeper into clinical care and access and looking forward at some system integration. Those are really the hot topics that we were hearing about at the Strategic Leadership Forum and what's coming. And a big part of the messaging that was going to your leaders was, this is the work that's coming, and are you ready, and how are we going to get there? And in so many presentations, the message was improvement facilitation and what is your capacity for improvement. So I wanted to share a few slides with you from a presentation that was given by Dr. Lee Green. And he did some research here in Alberta about what's going to help to take our work to scale. And of course, we're familiar with the diffusion of innovations curve. We'll take a closer look at it in the next slide. But I just wanted to set the stage to say we know that we do really, really well with pilot projects. We're good at adopting with our innovators and our early adopters coming on board and doing great things to start to transition. But how do we actually start to get the masses involved? And of course, right after those early adopters come a population called the early majority. And so Dr. Green and his team did some research to gain insights into how the early majority physicians and their teams they work with. They specifically looked at how they do chronic chronic disease management and how they think about and approach change. And so I wanted to share a few of the findings with you. And so the question they asked was about how they scale, and this is work. We talk about this in our improvement facilitator training about how we go to scale. This is something very well researched. And so after those early adopters do things, and so we can think about things like paneling, like screening, access, all of the things that we're doing in our work. There's those innovators who are like, yep, I was already doing that before you even thought of it. Then we get the early adopters who say, yep, you don't have to tell us. We can see our own value proposition. You don't need to sell me on doing panel. You don't need to sell me on why I would want to improve screening for my patients. But when we get to the early majority, what the research has found, and so we know that there's international research on this, but also our local research supports that the early majority, they think differently. And so we have to start to think about what are we going to do, what's special about the early majority, and how are we going to get them to cross that valley of death and actually scale up the whole of that patient's medical home. And here's what the research we did here in Alberta found. It said we need to think like the early majority. They do the work in small incremental steps. The work that they do needs to be based in the evidence. They need to see that the work they're doing is having a positive impact on patient outcomes. They need to hear about the work and the changes that they're going to do from a trusted source. They value support that's easy to access, and they need some help to see the bigger picture. And so I'm hoping as you look at these and you listen to the points of how the early majority thinks, as an improvement facilitator, you're like, yep, I do that. I can help them take those incremental steps. I can help them break down a problem. You know the evidence. You learn that as a part of engaging in the different initiatives that we're doing, and that you can bring this, you become a trusted source for your clinics and for their teams, and your support to them, and you help them to dissect it. So this is the big defining difference for this group, is that they don't swim upstream. That they do want to make changes. They're generally typically open to it. But an innovator and an early adopter will actually self-propel with change work, but the early majority won't, and they need to be led. And so we know if we're going to take it to scale, we need to have different ways of working with the early majority. And so this is what it is. There's standardization, and of course, we're trying to standardize the work that we're doing, but the work is actually going to take mass customization. And this is, of course, we're used to working with our change packages and going into a clinic and saying, how might this work best for you? So we go in as improvement facilitators with some principles, with some approaches. And so we're not just trying to say, here's one way to do it and give them a standardized package. We're customizing. We're customizing for each physician and their teams, and we're customizing for each clinic. And this customization and the research findings said we're going to need a larger and a more highly skilled workforce to take this, to take all of this work in patients' medical home to scale. And again, this had the spoiler alert earlier, improvement facilitators are that highly skilled workforce that Dr. Green and his team are referring to in this research. And so just a couple more slides on this. In their conclusion, they said there's 5 principles to scaling up. If we actually want to move the patient's medical home forward, get that early majority engaged, that they're going to need to be engaged in terms that make sense to them. And again, there's that emphasis, we're going to need those individuals who can engage them, and those are the improvement facilitators. We're going to have to help teams to learn to distribute the knowledge work activities and shift their mental models. And again, we see this as improvement facilitators being key in this work. And then number 3, it was pretty self-explanatory, that practice facilitation is essential. This work can't happen without it. You'll see there's a couple of other principles there. The research went beyond just looking at the improvement facilitation work, but of course, so it was much larger than that, but there's a really big emphasis on the work that we do. And so Ajil mentioned earlier, she had a piece of paper for you, that Improvement Facilitator Network information sheet. And as your anniversary present, we have a second piece of paper here, and it's up right now for you to access on the Collaborate site. There's a one-page summary report on the research study. There is a full report that is available, still in draft form. It was actually presented to your leaders, so they're gathering feedback on that. And you'll see at the bottom of the sheet here, you don't have to, you can go to the Collaborate website and get it, but you can request a full copy of that draft report if you're interested in reading more about what those research findings were. And there again, on there, you'll see those 5 principles that I just shared with you. So again, there's your second anniversary present is this one-page form. And so what's next? So we've heard that we've done this amazing work in panel and Alberta screening and prevention. We've heard that we have this research that has shown that we need to focus in on engaging the early majority if we want to actually go to scale with the work that we're doing. And that research gave us some of that direction on what it is we need to do. And so, of course, what's next? We already know all about the work coming, and we'll be hearing more about it over the next few months about what's coming with some of the opioid work we heard about last month. We'll be hearing a little bit more in the new year about some of the integration work that's going on. We'll be hearing from our colleagues as well about some of the care planning work. A lot of our improvement facilitators have been involved in the care planning innovation work that's going on. So we know that part's next. But from a more higher level, we're looking and speaking and working with leadership, or working together around the province around increasing the investment in improvement facilitators. And you'll see a little bit of this information on the panel report, which is the third piece of paper that is your anniversary gift this year and available to you on the Collaborate website, that shows that panel information from earlier and shows you about what we need to do to keep moving the work forward. And that's about increasing the investment in improvement facilitators. So what this is telling us, you'll see, is we actually don't have enough. There's not enough of us to actually do the work that we need to do. And so this is more for your information. Of course, this is the work and the decisions that leaders need to make. Leaders from across the province need to make in continuing to increase the investment in improvement facilitators. But this next piece, the change agent blueprint, is something that you'll be hearing a little bit more about coming up over the next few months. And this is a little bit more about the how we're going to do the work. So we need more of us, but we need to keep increasing our skills. Dr. Green's work said we need a highly skilled workforce. So how are we going to make sure that as improvement facilitators, we have all of the information, the training, the skills, the competencies that we need to do this work? And we're working collectively with your leaders on a change agent blueprint to say, this is what we need to know, this is what we need our improvement facilitators and other change agents working in the system. Of course, physician champions are a big piece of that work too, but highly focused on improvement facilitation. What are the skills, what are the competencies, and what are the methods that we're going to use to get there? So this is something that's also in development for our group, and that we can be bringing back to you through this network in the future. So I'm going to pause there and finish off with that part of the presentation on the celebrating the work that we've done, and a little bit about our work going forward, and pass it over to Alana, who's going to take us back to our theme of celebration and talk to a little bit about us, about how she celebrates with her team and helps her team celebrate.
Thanks, Lori, and thank you so much for that presentation. It's incredible to see the differences that we are able to make across the province. So in the spirit of celebrating, we thought that we would share how a couple of us have had fun with our teams. And we know that everyone's busy, but we hope that you take the time to celebrate with your teams as well. So in our PCN, I'm up at the Bighorn PCN in Hinton. We're quite small, so we do like to take the chance to acknowledge our milestones within our PCN and get everybody together. So one of my first initiatives as an IF was to help the clinics create a process for validating patients. I worked alongside the clinic staff and managers to find the appropriate approach that worked best for each clinic. And we had a monthly goal in the beginning to validate over 85% of our patients coming in for visits. And within the first 3 months, we were able to actually hit 90% in one of our clinics. So as a sign of appreciation, the PCN staff held a fondue breakfast for the clinic. So we wanted to make sure that the staff knew how much we appreciated them and their hard work and dedication. And on top of that, it was also a delicious way to start the day. So that's kind of one example of what we've done. I'm going to pass it over to Angile to share a story of what they've done at Edmonton South.
Actually, it's going to be Majeen, so she will.
Hi, so I'm Majeen. At the Southside PCN, what we did last May was we ran a competition across our clinics to see who would have the most of their patients verified for the month. So we ran a validation month contest, and 25 clinics participated. So we had a range of our verification rate ranging from 12% to 100%. And the average validation rate that we had was 69%. And 16,976 patients were validated in May. And overall, we had a 13% improvement in clinics. And so as a celebration, the clinic that won got their verification rate up to 100%. And so we were able to celebrate with the MOAs with a pizza party. And so it was a great way to acknowledge their hard work. And so it was extra motivation for them to continue doing what they're doing. So it was great.
Great, thanks for sharing. It seems to be a theme that we all like to celebrate with food. I know that I'm a big fan of food. I'm just going to go back. I do notice in the chat, Lori, that there is a question for you. Where are we going to get the education to improve our skills?
So thanks for that question. Thanks for sharing that with me, because I am projecting and I'm scared to move over to take a look at the chat and lose our screen. So this is going to be, it's part of our development with the Change Agent Blueprints, and looking at the different pieces. So specifically, I can think of the one that's coming up more in or coming up soonest is the work around opioids. And right now, those tools are being developed, and so we know that we're going to need to be able to give you the tools to engage and do your elevator speeches. So a lot of the work that you're doing and the skills that you're using are being recycled. You're transferring your skills from initiative to initiative, right? We learn about how to do that elevator speech, but giving you the tools and information that you're going to need to create your elevator speech to start building that awareness and desire, and then building the change packages as well, so you can start to take those and apply them and extrapolate. So that's one piece, is you actually have, there's a lot of the skills that already exist, and it's a matter of starting to plug in some of those pieces. And then in addition, it's going to be, well, where are the gaps for us as improvement facilitators to take it to the next level? And is it in, are we going to require more in-depth skills in quality improvement, as we get to the next stages and into more complex work? And I see that as we may need to build our own internal resources in Alberta to do that, or are there existing tools through organizations like the Institute for Healthcare Improvement that we could tap into to start to build those skills? So it's a really great question. We don't have all of that, the pieces planned out for the initiatives that are coming up. We've had it to date, but that's part of putting together that blueprint is to create that plan. So what is it? What are our gaps? And how can we start to fill them? Do we need to do our own development, or do they exist already? And we'll pull that together. Does that answer the question, or? I'll wait for somebody else to tell me what's going on in the chat.
Charlotte just said thanks, so we'll say yes. Thank you for that. That was great, Laurie. So we know that the power that celebrations have to raise morale and reinforce positive behavior. Plus, life's more fun when you stop to appreciate both the big and small moments and milestones. So we do encourage you and your primary care teams to celebrate as often as possible. And we know that the IFs are out there doing the heavy lifting, and evidence shows that everyone is making a difference. So we would like to just pass out a big thank you to all of you for the work that you do. We know that without the support from the full network as well, that us as a co-design team would definitely have a much harder job. So we just want to pass along that big thank you to everyone on the call and their teams as well. And we would also like to thank the rest of the IF leadership team and the coordination team for all the work that they do as well. Again, we need the support from everyone, and it makes our jobs easier. So we do appreciate everybody's help and support with that. And just a reminder that of the resources, our paper presents to you from today are on the IF Network website. And you'll see there that is the address to go to click on Collaborate and onto the Improvement Facilitator Network link. And we know that there may be some new improvement facilitators on the call today. So here's just instructions of how to join the Collaborate website. So there is the email address info@pcnpmo.ca, and just to put the subject, join IF Network Collaborate website, the information that needs to be included. So first name, last name, email, your contact information, where you work, and what your role is and why you would like to join. So there will be a confirmation email that does come back to you with your login information after you have sent your request in. And also to make sure, once you have joined the Collaborate website, you will receive emails from the IF Network at albertadoctors.org. If you do have any questions, comments, any kind of feedback for us, please email us at ifadmin@albertadoctors.org. And just a reminder, webinars are scheduled for the first Monday of every month except for holidays, and email reminders will be sent out to everyone that is on the mailing list, and our next webinar will be held on November 5th.
Thanks, Elena.
Go ahead.
Go ahead.
I was going to say, it looks like we have a couple of minutes. I'm just wondering if there's anybody out there who would like to type in another question for any of us, either about the information that Lori shared or about the IF network or the Collaborate website. We do have a couple of minutes that we can stay on the line and answer questions.
I was also going to ask the IF leadership team, and maybe some of you can type it in if you know as well. There's all of the topics are in my head for the upcoming webinars, so I don't want to misquote what the November webinar is. I think it was around data, but I'm not sure, so I was hoping somebody could just give us a quick plug on what the topic is for the November one. I don't want to misquote it.
No, we just had Charlotte just typed in, and our next webinar will be on data storytelling.
Data storytelling. Perfect. Thank you so much, Charlotte. And I guess I was also going to say, because I presented some of Dr. Green's research work, one of the members of his research team is listening in on the call today. If there are any more specific questions about that research, of course, I just really skimmed the surface of all of the amazing work that they did. So just so you know, if you have a burning question right now, Kylie Kidd-Wagner is on the phone, or her contact information is also at the bottom of that one pager that's on the Collaborate site.
I'm keeping an eye on the question box, and it doesn't look like we have any more questions. So I think we'll give you the gift of time also and let everybody head out. I'd like to thank my colleagues for helping host the call today. As well, a reminder that we'll be posting the Wordle that you guys created on our Collaborate site and the other pieces of paper that we promised for our first anniversary. Thank you, everyone.